Freshman class, what is going on? Welcome to Coach Moore's basement. Last time. Let's do this one more time. We're going to talk about some sex today. There's one lecture that this needed to happen in person. It's this one. This is going to be tough to do online for a lot of reasons, and I'm not going to be able to. This whole unit really was something that it's unfortunate that we got to do online because I can't. We just don't get to have. I don't think you get to learn as much online as you do in person. Um, and I think honestly, being online makes it a little bit more awkward for everyone. But we'll do our best here. Last lecture, it's going to be long. That's why I'm giving you today, Wednesday, and tomorrow to do this. Um, so break it up, take your time. I have time right now, so I'm doing a super long lecture. You don't have to listen to this or watch this all in one sitting. Hopefully you're going up north or somewhere where it's nice and warm and you can relax while you listen to this or watch this. So thanks for taking me up north with you. I promise I'm a good roommate or wherever you are. But hopefully the weather is supposed to be nice and hot this weekend for us. So hopefully everybody can get outside and maybe get a little bit return to normalcy here heading into summer. So couple of things before we start with the lecture in terms of logistics. So you should be doing right now this lecture today and tomorrow. Nothing Friday, nothing Monday. Tuesday's a chapter 22 test. I just want to make sure you get into your textbook when it comes to chapter 22, different way of seeing the same stuff. And then on next week, Wednesday, Thursday, and Friday, you have 3 days to take your unit test. I'm assuming teachers are going to flood, the last week with exams. So I'm just going to make it available for 3 days. You can get it to me any part of those 3 days. Your unit test will look a lot like the last one did in terms of it'll just be multiple. You'll have basically options to choose from when it comes to short answer questions. So I'm going to give you 3 days to do that. If you are missing work, don't have work in, you need to email it to me so that I can give you guys credit. I've been extremely reasonable with giving you credit for late work. I'll continue to do that. I continue to say this is a weird time for everyone. It's a weird time for me, for you. These are not normal times. So I'm being very flexible with you guys getting me work. So if there's something missing, if your grade's not where it needs to be, send me an email. Let's talk about it. Let's figure it out. We can get it where it needs to be, right? So next, probably a week from Monday, I will have grades finalized, and that is what your grade is going to go into the grade book as. If you don't like it, email me. Let's talk about it. Let's get it straightened out. We can get it fixed. And then we can go from there. All right. Last lecture of the year, people. Let's do this. It's a long one. Buckle up. If you're in a car, you should always buckle up. But last lecture of the year. Let's enjoy it as best we can. So first thing I want to show you is this. So this is posted to Schoology at this point. This is so what there's a little bit more to this lecture today. So this is just for this lecture. 2 bell works, a couple other things, and an exit pass. Oh, Coach Moore, you're killing me. You'll be fine. All right. So make sure you have this document available along with your notes. I think this will help you when it comes to your unit exam for sure. And I think that this in your notes, having that happen for your unit exam is going to be real helpful. So no Mrs. Coach Moore today. Just me. So hopefully that's okay with all of you. And if it isn't, too bad. Okay. Anyway, chapter 22. Let's do this. Get excited. Get excited. It's about sex. I mean, how is this not going to keep your attention, huh? All right. So as the man in the top right corner says, top left there, we got a lot to talk about in chapter 22. Okay. It's about sex and I mean, that's it. It's everywhere. Let's talk about it a little bit as best we can here. um, you know, let's get into it. So specifically what we're talking about when it comes to sex is STIs. All right. So what is an STI? An STI is a pathogen that spreads from one person to another during sexual contact. All right. So let's talk at first, like, what is sexual contact? And this is important to note. When you guys go to the doctor's offices and stuff and they say, are you sexually active? They're basically meaning, are you sexually active in any sort of sexual relationship? Um, a lot of people don't really understand what that means. But if you're talking about sexually active, you're talking about any type of sex that you're having. So, vaginal sex, oral sex, any kind of sex that's being had means that you are sexually active. Okay. And being sexually active puts you at a higher risk for an STI. I think one of the reasons, and you'll see some numbers as we go through this, one of the reasons STIs are high, is because there's people don't understand the risks that they're taking when they participate in different types of sex. So an STI is simply a pathogen. We talked about pathogens last time, right? You talked about bacteria and virus. Those are your two basic ones. There's others. There's fungus and protozoan. We didn't really get into that for lots of different reasons. But we'll continue to talk about bacteria and viruses in terms of pathogens. And so what happens basically is person A has an infection, all right, and then they engage with some sort of sexual behavior with person B, and now person B has that infection. It's really that simple. Some of them aren't as serious as others. Some of them are unbelievably serious. Some of them are rare. Some of them are unbelievably popular, right? But an STI just means that there is a sexually transmitted infection, right? So an infection that gets transmitted from person A to person B via sex, right? So that seems like an appropriate image there from Johnny Depp. Some harmful effects is discomfort, and this is short term. Honestly, you don't even need to write this part of the slide down. But discomfort, embarrassing, pain. I put dollar bills. Don't worry about that. If this was in class, I'd probably explain this a little bit longer. But basically, in the short term, what you're talking about when it comes to sex is, excuse me, when it comes to STIs, is you have a lot of teenagers or even kids in college, even young adults are going to have a difficult time, especially if they're on mom and dad's insurance, going to mom and dad and saying, hey, I think I got an STI. So when it comes to paying for it, it comes out of your pocket and becomes expensive to pay for as you try to work your way around mom and dad's insurance, or, for whatever reason, when you go to the doctor. Discomfort. Some of the STIs that people get can cause some discomfort. We'll talk about that. Embarrassment. One of the reasons that STIs are passed on is because people don't want to think they have them. So they kind of ignore them. And that's actually very easy to do for lots of reasons, which we'll touch on. And long term, and these are very rare. If we're being totally honest, these are rare in terms of long term. Death. I mean, that's you're not going to die from an STI, most likely. Higher risk of cancer. It's possible. It's not likely. Infertility. It's possible. It's not likely. And we know that infertility is what? Right. Can't make babies. And we'll talk about some reasons that might happen as well. All right. But what is an STI? That's the big takeaway from this slide. It's pathogen that spreads from one person to another during sexual contact. All right. Sex is a risky business. Risky Business is actually a movie. I don't know. I've actually never seen it, but it's a real thing. Like, Tom Cruise joins our lecture today. Coach Moore crushes it. I mean, he just brings his A game every time he's lecturing. All right. Couple of things bouncing in here. High risk behavior. So if we were in class, basically what we would be doing is you guys would be in groups and I would be listing off different behaviors, and then you would be ranking them. That's high risk, that's low risk, that's no risk in terms of what's going to happen from these different behaviors, right? So something like kissing, that is a no risk behavior. Okay. You can kiss people and you might get the flu, right? Or, in this case, you might get some other virus that's going around from making out, but you are not going to get an STI from kissing. All right. So that'd be a low to no risk behavior. Okay. Being sexually active, that's a high risk behavior. Okay. That if you're sexually active, you are putting yourself at risk for an STI. It's really that simple, because they are a lot more common than people probably want to give them credit for. I'm not saying everybody out there is a walking bag of STIs, but it happens. So being sexually active puts you at a high risk, and then ignoring risks. So whether that risk means you're ignoring it, you have an STI and you're ignoring it because it's uncomfortable, or you're doing other risky behaviors that are leading to giving you even a higher risk of STIs, right? Abusing alcohol, abusing drugs, those things put you at a higher risk for STIs. That's just what it is. What it is. So, um, multiple partners, the more people that you are sexually active with, the higher risk for STIs that you have. We'll talk about that here in a second, and then not seeking treatment. We just kind of talked about that. All right. So I don't think there's much new here. Probably not worth much writing down. Nothing on this slide is going to be on your unit exam. Tom Cruise will not make the unit exam. All right. This is probably a partially going to be on your unit exam. All right. Avoiding STIs. How do you do it? You practice abstinence. All right. If we were in class, I would kind of share a little bit about this in terms of my life. I've made a lot of mistakes in life. One of the things I haven't done is I haven't made, not that it's necessarily a mistake, but the only person I've ever been intimate with is my wife, and it's been a very good thing for me growing up Catholic. It's just how I was raised. It's something that I thought was important growing up. So in terms of our Catholic belief, it's important in terms of the relationships that I've had with people. This has been a blessing in my life. Not only has it been a blessing in my life in terms of relationship with my wife, but it's been a blessing in my life in terms of there's a lot of stress that I didn't have to endure that I've seen people go through from being sexually active at a younger age. So practicing abstinence, if you're not having sex, you don't got to worry about getting an STI, right? If there are people, if you have a relationship with someone who's never had sex with anybody else, and you guys are both had practiced abstinence and now you're engaging in sex, you don't have to worry about STIs. Okay. The more people that you have that type of relationship with, the higher there's a risk of you transmitting an STI or getting an STI. It's just the facts of the matter. Okay. So abstinence isn't good for you just from an emotional or spiritual place, but it's also good for you physically. So you talk about the health triangle that we've kind of turned into a health square over the last 3 months. It makes life a lot less complicated. I'm not saying that it's easy or anything like that, but it makes it a lot less complicated. That's for sure. So practice abstinence. That's how you avoid STI. So that's important to understand in terms of how, if there was to be a test about if there was a test question about how STIs are transmitted, that would be a way to do that. All right, real quick. Sorry, there's one more bullet point that didn't pop up here. We've talked about drugs, alcohol, tobacco. Specifically with drugs, STIs are also spread from blood to blood contact. So if I'm using a needle and then I share that needle with someone else, if I have an STI that can be passed through blood, I just pass that STI on to somebody else. So a lot of drug users will struggle with hepatitis. And that's the reason why, is hepatitis can be spread not only sexually, but it can be spread blood to blood. So sharing needles is a very easy way to pass an STI from one person to the next. All right. It says tattoos and body piercings. I mean, if you're going to a reputable place to get a tattoo or body piercing, you're going to be fine. If you go to, Johnny's Garage and you want to get a tattoo because you're under 18 and you don't want mom and dad to know about it, there's some risks there. There's a needle involved. There's blood involved. There's some risks there. So, I'm not encouraging tattoos or body piercings, and I'm definitely not encouraging them from Johnny's Garage. But if you're going to, a place that doesn't have a license and stuff like that, that's a little bit of a risky behavior, because you could be sharing blood without really knowing about it. in terms of the needle that's being used. So that's possible. All right. So, and then alcohol. Very simply, alcohol impairs your decisions. We've talked about that when we talked about the alcohol unit, and we talked about drugs a little bit. It affects the decision-making part of your brain. It's very simple. So you're going to do things on alcohol that you wouldn't do sober. And that can lead to some regret, and that can lead to some decisions making that you wish you wouldn't have made. And that can really, really make things complicated in life when you start mixing alcohol and sex, or drugs and sex. It can get really complicated in lots of different ways. So, you know, I would really encourage us to be very, when you're making decisions that talking about risky behavior. You guys probably think I'm the world's biggest square, but with age comes a little bit of wisdom. And so with that being said, when you start mixing risky behaviors in with each other, you're putting yourself in a position of being vulnerable, and that can be bad. That can go the wrong way in some situations. So just something to be aware of. Okay. It's important. All right. Moving on here, I think. Absence, if that wasn't clear. Oops. If that wasn't clear, it's just avoidance, right? So if here's one of your first bell works. Now I think there's 3 bell works in this presentation in that document that I've shared with you. That I'm only asking you to do 2 of them. All right. So this, and a lot of these are going to be like your potential test questions, short answer questions, which is why I'm making you do them. All right. So you can, pause this or speed this up, whatever you want to do when it comes to the bell works. I'm not going to spend too much time on these slides. What is an STI? What are risky behaviors lead to obtaining them, and how do you avoid them? Simple question. Good test question. That's your first bell work. If you want to do it, pause this and do it. If you don't want to do it, keep on going. I didn't forget about the bell works. They're just kind of mixed into this presentation. All right. The most common STI. So now we're going to kind of talk specifics, and maybe some of the stuff that I mentioned earlier will make more sense here. We start talking about symptoms and how these get spread, and why some are more popular than other. All right. Chlamydia, Chlamydia. All right. It's the most common bacterial STI. It's a bacterial STI. So because it's bacteria, that means that in order to fix the problem that is bacteria, bacterial infection, you need to have an antibiotic. So these are fixed with antibiotics. Okay. A bacterial STI is anything that you see in terms of a bacterial STI means that we can solve this problem with a antibiotic. Okay, so chlamydia has an antibiotic. Now, we can kind of really nerd out if you want to, and some of the things that happens with antibiotics, especially to the more popular antibiotic or bacteria that's causes, the antibiotics is becoming much more resistant to antibiotics. The bacteria, is becoming more resistant to antibiotics because the bacteria has seen the antibiotics so many times, right? So that's one of the things about antibiotics that's happening as we use them more and more frequently, as people need them more and more frequently. But this is, anyway, long story short, this is the most common bacterial STI. Sorry for my distraction. I don't know why this next slide's not coming up here. It's a bacterial infection which affects the female vagina and the male urethra. What does this mean for treatment? We just talked about it. All right, it means that there's an antibiotic. Symptoms for males: pain during urination. All right, that is going to be a common symptom with STIs. Pain during urination, whether you're male, you're female, it really doesn't matter. It's a relatively common symptom. So if I had to guess, if I had to guess about a symptom for an STI, that's probably where I would start. Is pain during urination. Unusual discharge, also very common. All right. Just because that happens doesn't necessarily mean that you have an STI, but it can. All right. An unusual discharge basically means that you're getting some sort of discoloration, probably most likely pus-looking discoloration exiting from the penis. And basically what that pus-looking discoloration is it's your body attempting to kill that bacteria. So it's creating that pus and it's exiting, it's exiting out the body. Specifically with chlamydia, not always obvious in females. Males, it's pretty hard to ignore. Not necessarily true in females. It doesn't necessarily present itself the same way. All right. So from a medical standpoint, if I'm a female, there's a very good chance that there's a chance that I have this and don't know it, which is one of the reasons that this gets passed on from one person to the next is because I don't know that I have chlamydia. I engage in a sexual relationship with someone else. Now that person has chlamydia, right? And it's not because I'm mean and a terrible person and I felt like getting someone sick. No, I just didn't know I had it. And that happens a lot when it comes to STIs. All right. So not always obvious when it comes to females, but you can get some discharge. And again, it's typically yellowish. If left untreated, it can lead to pelvic inflammatory disease. So this is a really good short answer question for your test. And I'm not going to have a Bellwether question on it, but it's a good short answer question for your test. All right. Pelvic inflammatory disease is specifically for females and it's specifically caused by chlamydia. All right. It can be caused in other ways, less, but when you're talking about pelvic inflammatory disease caused by chlamydia, how does it happen? I don't know. I have chlamydia. The bacteria does damage to my system. And then a different disease presents itself due to my chlamydia. Right. So chlamydia is step A or step number 1. Step 2 then becomes pelvic inflammatory disease, which is a different disease caused by chlamydia and causes different complications in my body. Right. Can be transmitted to child during delivery, can cause eye infection, blindness, and sometimes pneumonia. You don't want little kids to have pneumonia. Typically speaking, this is rare that a mom will deliver a baby with chlamydia. Typically, if you're pregnant, you're going to get a bunch of different STI. You're going to get a bunch of different STI tests or a bunch of tests done. So that the doctor knows how healthy you are and what's going on for the purposes of protecting the baby. Okay. All right. Coach Moore, keeping that attention with those transitions. All right. Next STI up. Oh, no, I'm sorry. So this is pelvic inflammatory disease in terms of how it works. Chlamydia. All right. So here's your normal aid on this side of the screen here, on the left side of the screen. Your eggs usually go from a female from the uterus to the fallopian tubes to implantation, right? Well, what happens here is that the fallopian tube with pelvic inflammatory disease, you get this buildup of scar tissue essentially from your body fighting the bacteria, and then the egg very simply either struggles to get through that scar tissue, right, or as the sperm enters the fallopian tubes, which is where, as we know, fertilization happens. All right, as the sperm enters there's such a buildup of scar tissue that it's very unlikely or not likely or impossible for that egg to get fertilized. So that's how it can cause infertility in terms of chlamydia causing infertility. Now, again, it is the chlamydia that's causing it. Specifically, we're talking about pelvic inflammatory disease, which is caused by the chlamydia. So this is kind of the effects here. All right. And you kind of get an idea of what that looks like here in this picture. In terms of how that happens, right? All right. Gonorrhea, also known as the clap, okay? Anyone who's sexually active can get gonorrhea. I don't know. I just kind of thought that picture might keep your attention. I mean, anybody who's sexually active can get any of these diseases, all right? Gonorrhea is another very popular sexually transmitted infection. It's a bacteria. What does that tell us? Yes, very good. That tells us that it can be treated with antibiotics, all right? Again, the symptoms are going to be different for females and males, as you'll see in most of these STIs, and that can be true with a lot of different viruses that or bacteria infections, not always presenting themselves the same way depending on whether you're a male or a female. Specifically, again, you're seeing the pain during urination and discharge, very common. The big difference here with gonorrhea is abnormal menstruation. So your cycle may be very short, could be very long. So a difference in your a difference in your menstrual cycle for females. Most often symptoms are mild. They may not even be noticeable, which is how this can go. Again, see, with multiple partners, you're talking about, person A and person B having a relationship, and then person B has a relationship with person C. That's how these things get transmitted because, person B didn't know that they had it. Maybe person A didn't know they had it, right? So that's how these things kind of move from one person to the next. Male symptoms: pain during urination or burning during urination, specifically burning. All right, swollen lymph nodes of the groin. So lymph nodes usually, typically speaking, if your lymph nodes swell, it's some sort of a sign of an infection, either big infection, mild infection, but a swollen lymph node can mean a sign of infection. Typically it does. The burning during urination, if you think about why you're burning during urination, because again, there's, for lack of a better term, there's a wound, all right, in an area, and then you're running urine through that wound, right? So, I mean, imagine having imagine having a cut on your finger and hot water goes through it, right? There's burning, okay? Because you have a cut and now you're having hot water go through it. It's not exactly the same, but that's kind of the idea, right? There's something wrong in a specific area of your body that you're now running urine through. Ouch, right? That's why it's burning. Gross. I mean, it's not the only reason, but I'm trying to just kind of portray you what's going on there, right? Gonorrhea, also known as the collapse. Those are your bacterial, some of the bacterial STIs. All right. HPV, this is the most common STI. This is kind of off the charts in terms of popularity. Affects roughly 80% of all Americans that are sexually active. That's amazingly high, 80%. So if you're sexually active, there's an 80% chance that you have HPV or one of its strands, right? Now, that's kind of scary. It's not kind of scary as we delve into this. So there's 200 different strands of this virus. Some of these strands people have, most specifically, and we'll talk about this specifically for males, some of these strands people have and have no symptoms. Male, female, sometimes there are absolutely no symptoms of HPV. So there's no way anybody would know that they have it, right? So it often causes no symptoms. It often causes no symptoms specifically in males, but it can cause no symptoms in all kinds of different, sorry, my daughter's walking down, and so I'm super distracted. It can cause no symptoms in different people. Hi. Different, both genders, male or female. Some people never affected because the immune system destroys the virus, but they still carry and pass the virus on. So what can happen essentially is I can have this virus, have no symptoms of it at all, not know that I have it. I can take a test for it. The test can tell me I don't have the virus when I do. All right. And therefore I can then pass that virus on. So I can do everything I can to try to be responsible and make sure I don't have this virus before I pass it on to the next person. And then I go ahead and I pass it on anyway, because it just affects so many people differently. All right. Now those 200 strands are not all created equally, if that makes any sense. Some of those strands are much more serious than others. So having it isn't necessarily the end of the world depending on the strand. All right. So sometimes your immune system destroys it. And honestly, they're finding a lot of people, their immune system over time can destroy the virus. So you can still be a carrier, but you aren't necessarily going to see any of the symptoms or any of the problems that arise from having HPV. Okay. It can cause genital warts. Those can get removed and those can reappear. All right. If you ever had like a wart on your toe or something, they burn it off. So if you want to get rid of genital warts, sometimes they burn them off. Sometimes, they go away by themselves. And then sometimes they will reappear. Typically speaking, when your immune system is weak, so if you're fighting off another disease, this will reappear. Or this will start rearing its head in terms of genital warts. Cervical cancer, again, it's possible with HPV. Not everyone that gets HPV gets cervical cancer. In fact, most people don't, but it is a possibility that some of the strands are known for causing cervical cancer, specifically in women, which is why if you're a female, specifically as you get older, Pap tests become so important. All right. So this is a little bit out of date, actually. There is a vaccine for the most popular strands of HPV. They protect against 4 types of HPV that can cause 70% of cancer, 90% of genital warts. So I think there's 3 different shots that you get for this for HPV. You can get the vaccine at the youngest age of 9, and it says it used to be to 26. They recently adjusted that I think it's now into your 50s where they'll still give you the vaccine. Um, the benefits to males are kind of unknown because, again, when you're talking specifically in terms of symptoms for males, there usually aren't any. Most of the time, HPV only presents itself when it comes to females. Um, so, like most other cures for a virus, the cure is to get it and get over it. Um, so that's kind of how this vaccine works, although it's just such a low dose of the virus that, again, you aren't going to get any of the symptoms or any of the negative side effects from the vaccines. It's a newer vaccine, I would say, but it is out there. Right. And again, it protects you against the most dangerous strands, protects you against most of the most dangerous strands of this virus. All right. So that there is a picture, and this is when we say warts for genital warts, this is kind of what a genital wart looks like. You can get a genital wart in your mouth, so you can have oral genital warts. If that makes any sense. You can get that in different ways. But that's kind of what they tend to look like. So if you've had a wart on your foot, the wart on your foot is not going to look similar to a wart that you would get from genital warts. And that's HPV. Okay, a really popular STI just because it's so easily transmitted. And specifically, again, when it comes to males, I don't know if I'm driving this point home, males usually get no symptoms of HPV, very rarely. Maybe we'll get genital warts, but typically speaking, males will get no symptoms. And there's also really no way to test for it. So when we talk about the vaccine having unknown benefits to males, it's because it's really hard to tell because there's no symptoms in males most times, right? The virus just lays dormant in males, but it also gets passed to females in sexual activity, right? So, the vaccine for males is kind of like, does it benefit me? I don't know because it's hard to tell. But for females, seems to be a lot of benefits to females when it comes to the vaccine. Now, again, if you remain abstinent and your husband remains abstinent and you get married and have kids, this isn't something you got to worry about. But the vaccine then wouldn't be, that's a perfect world. We don't necessarily live in a perfect world. Okay. Herpes. Michael Scott had herpes. That's a real thing. Herpes is a virus. Okay. A lot of times, like all these other ones you talk about, it's hardly noticeable. This is what it looks like. All right. Painful blisters. Only instead of getting them around your mouth, you're going to get them around your genital areas. There's no cure. That's not necessarily something to worry about in terms of, oh my God, there's no cure for this. There's ways to deal with it, even though there's not ways to stop it, if that makes any sense. Periodic outbreaks, similar to getting genital warts from HPV, your genital herpes will probably show up when you're sick with another virus. Okay, so I get the flu, because my body's busy fighting the flu. Genital herpes is going to have it's going to be much more possible for the blisters to appear at that point. Okay. Can affect the child during birth, could cause death. So the doctor will probably recommend a C-section. If you're someone who has a history of herpes, it's possible that the doctor recommend a C-section. It's possible that they don't. That's a discussion between you and your doctor. So Michael Scott had herpes. That's a real thing. If you remember that episode, for you Office fans out there, and he called all his former girlfriends to inform them that he had herpes. Now, there are 2 strands of herpes, if that makes any sense. So if you ever had a cold sore before, and that's what Michael Scott had. So did Michael Scott have herpes? True or false? True. He had herpes. Okay. But there is a cold sore strain of herpes that you can get, and most people have, and most people get just from being human and being alive. And then there specifically is the STI strain of herpes that you're going to get specifically from sexual activity. So it's the same virus, but there's 2 strands, right? So Michael didn't necessarily have an STI. He just had a cold sore, right? Now, it's the same, it is a virus, right? It is herpes. So if you have a cold sore, yeah, you have herpes. But it's, just because I have a cold sore doesn't mean that I'm sexually active or, it's something to be embarrassed about. People get cold sores for all kinds of different reasons, right? So yeah, technically it's herpes, but no, it's not genital herpes, right? It's not the same thing. All right. So yeah, cold sore is herpes, but it's not the same thing. All right. Bowel work. Oops. Excuse me. How does pelvic inflammatory disease work? How do you get it? What does having this disease mean? And is it treatable? Pelvic inflammatory disease. It's a good question at the end there. It's a good short answer question. Is it treatable? So that might be something that we didn't really talk about. But so chlamydia is treatable. Pelvic inflammatory disease, it would depend on at what stage they find it. So there's different things that they can do to people who are struggling with pelvic inflammatory disease. So so especially young people who don't know any better will think, oh, well, what specifically in the genitalia area? All right, this is kind of what the sores look like. This picture of the hand up here. That's the first stage. All right, the secondary stage is that you'll get a sore in the mouth and you also get flu-like symptoms. These 2 stages, this is a bacterial infection. At these 2 stages, this is still very treatable with antibiotics. Okay, as you start moving into the 3rd and 4th stage, this becomes much less treatable. All right, this picture in the upper right hand here. She may be a bag of trouble when it comes to syphilis and gonorrhea. This is actually, if you study history, this is a World War II like propaganda poster that was encouraging or trying to get the attention of people at that time to stay away from basically unprotected sex because there was seeing an uptick in STIs around World War II. So they started making propaganda posters that encouraged you to not, engage in sexual activity. 3rd stage is the latent stage. So what'll happen when it comes to syphilis, or what can happen, is that this goes away for years, right? So 1st stage happens relatively quickly after exposure. 2nd stage happens weeks after exposure, right? And then for years, you might have no symptoms at all. And then it'll kind of rear its. Meanwhile, while you are having no symptoms, the bacteria is causing problems in different areas of your body that you really have no idea it's causing, because again, you have no symptoms at this point. You're asymptomatic. So symptoms may disappear for years. During this time, the bacteria attacks different parts, specifically your brain and your heart. So once you start getting to the latent stage, you can still kill the bacteria in theory with an antibiotic, but the damage that the bacteria does, the longer it's in your body, you can't repair that damage, right? So the tertiary stage basically means at this point that it can't be stopped. So I says no cure once progression is beyond stage 2. Specifically, there's no cure for the damage that it does. All right, and in stage 3 is when it starts affecting your internal organs, your heart and your brain specifically. So people with syphilis can literally go crazy because the bacteria is basically feasting off of their brain, right? And if your brain starts going away, you might start acting a little crazy, right? So again, extreme. That's an extreme, but it can happen. Can be passed during childbirth. Syphilis can. Okay. All right. Deep breath. Deep breath. Coach Moore, you've been entertaining. You've been great. This is not awkward. Talking about sex, not awkward at all somehow, right? Let's delve into one more STI. Okay, one more virus, which is at one time, especially when I was your age, a little bit more scary, and that is HIV and AIDS. Okay, this was a new virus that was found in the 80s, maybe late 70s, early 80s, mid 80s. And when it came out, there was a lot of people that were kind of panicked about it because it, much like the virus that just came out right now, people just don't know yet. In the early stages of viruses, people don't know. They don't know how the virus is passed, the symptoms it causes, how damaging it can be. There's just a lot they don't know yet. And that kind of was going on when I was a kid and when I was getting into my teenage years. I would say that at this point, HIV is I don't want to say handled, but they've progressed greatly when it comes to dealing with HIV and AIDS. If you don't know who that is, you're probably because you're not nearly as old and as boring as Coach Moore. That's Magic Johnson. He kind of became the face of AIDS, an extremely popular basketball player, and really in the later stages of his career, but not totally out of his prime. He was diagnosed as being HIV positive, and it ended his career briefly for a short period of time. He made a comeback. His comeback wasn't anything really spectacular. And there's, if you look at interviews of the time when he was playing and he was diagnosed with HIV, there's guys who didn't want to play basketball with him because they thought he was going to give them HIV. Sounds kind of crazy now, but at the time, people didn't know, right? People didn't know if I'm guarding a guy that's HIV positive, and he's sweating and I'm sweating, can that virus transmit? Now, no, we know now that it can't, all right? At the time, people didn't know. So there was a lot of people who didn't want him to play in the NBA because they thought he might pass the virus on, all right? So let's talk a little bit about HIV and AIDS. So extra point majority. So there's a section for this. Do this because you can get extra credit. There's nothing to be lost by doing this. It's a very simple exercise. All right. So person A has AIDS. Okay. Person B does not. Two people. Person A and person B engage in unprotected sexual activity. So the question very simply becomes, does person B have AIDS? It's a simple question. All you're going to write in your extra point majority is yes or no. If you have no idea, take a 50-50 chance. Okay. One word, yes or no, you could get yourself some extra credit points here. It's really simple. All right. So does person B have AIDS? You can pause this and think about it. You can pause this and cheat. You can Google it right now. I don't care what you do. The answer is no. Person B does not have AIDS. Now, person B might be HIV positive, but they do not have AIDS. They might be HIV positive, but they do not have AIDS. Two different things. The point of this whole slide is to communicate with you that AIDS and HIV are two different things. One is a virus. One is a disease that the virus causes. Okay, but AIDS and HIV are not the same thing. Okay, they one causes the other. All right, but if I'm HIV positive, I don't have AIDS. Okay, I can be HIV positive and never get AIDS. All right, and nowadays, especially in the United States, medicine's to the point where that's extraordinarily possible. And that'll make more sense kind of as we progress through this, I think. But HIV and AIDS, not the same thing. HIV, the virus, can cause AIDS, and we'll explain that as we kind of go through this. Okay? All right, so no would have been the right answer. So if you cross out yes and write no, I'm not going to know. I'm not going to know. Okay? You guys can get yourself some extra credit points there. All right? All right. Moving on. Come on, slide. HIV infection, human immunodeficiency virus. Okay, so when you're thinking this is, I like to explain AIDS, or excuse me, HIV, the virus HIV. It's not like the Hulk of viruses, right? This isn't like a super strong virus. It's not like a, unstoppable virus because of its strength. I don't want to, I'm not trying to humanize the virus, but it's kind of like a very intelligent virus, for lack of a better term. Or maybe just a very lucky virus, whatever you want to say, because of how it replicates. All right, so it's the human immunodeficiency virus. Okay, affects 1.4 million people in North America. 13% of those affected are between the ages of 13 and 14. I wouldn't write either one of those stats down. I would know that it's the human immunodeficiency virus. HIV develops in AIDS. That's not worded well. The better word there is causes. Okay, that's really poorly written by me. HIV if I could do it right now, I would scratch out develops in and I would say causes AIDS. These are two different things we're talking about. One causes the other, right? Like, kissing doesn't cause the flu. Okay. That's a bad example. HIV develops into AIDS. So, this will make more sense as we go through it. Let's just kind of hang tight. All right, AIDS is acquired immunodeficiency virus. Why is it not AVES? I don't know. You'd have to ask the guy that named it. All right, I'm just talking to you about it. How it works. So this is going to get a little long-winded here without any cool transitions or side effects. So just kind of hang tight with me as we go through this. All right, so simply put, the virus attacks specific cells of the immune system. right? So we've talked about two different things the last time we've kind of lectured here. One is the immune system, and the other one is how viruses work, right? So viruses aren't quote unquote alive, all right? And your immune system works by creating all these different cells to attack what your body sees as foreign pathogens, right? So when it comes to the HIV infection specifically, the cells that the virus attaches to are your immune system cells. All right. So why does that matter? How does this work? So I get a virus. Okay. My immune system creates a bunch of cells. We've talked about this: T cells, B cells, creates all of these cells to go fight that virus, to go fight that pathogen. With HIV, what's happening is as your immune system is making these cells to fight the virus, okay, the virus of HIV specifically attaches itself to your immune system cells. Okay, so what does that mean? Well, let's look at the thing. So it attacks specific cells of the immune system. That's kind of what I just talked about. I'll clarify that as we go through here. It disables the body's ability to fight other pathogens. Once the immune system is severely disabled, the patient has AIDS. This will make more sense. So I get HIV. It's a virus. My body says, no big deal. You have a virus, right? What does it do? It starts replicating. It starts making T cells, starts making cells to fight off the virus, right? Not a big deal. And so what the virus, specifically HIV, does is if I make a T cell, let's say I make 10 T cells, okay, just keep things simple. I make 10 T cells. What the virus does is it attaches specifically to your T cells, right? So I make 10 T cells and one of them has the HIV virus, right? So my body, what does my body do? I still have a virus in my body. It recognizes there's a virus in my body. I got to make more T cells. So it makes 10 more T cells, okay? And now 2 of those 10 cells are HIV positive. Is this making sense? All right. So is the virus gone? Virus isn't gone. Your immune system recognized, hey, you had a virus. I got to make more T cells. Makes more T cells. Now you have 3 of those 10 cells have the virus, are the actual virus. So what this virus does is it attaches to the cells your immune system is making to kill it. So therefore, as your immune system makes more cells to kill the virus, it's actually making more of the virus. So that's why this is like the Einstein of viruses, because it's like, as you produce things to destroy me, you're also producing me being the virus, right? Not me being Coach Moore. We don't need any more Coach Moores. One Coach Moore's great. Okay. But as I reproduce, as my immune system reproduces and produces cells to kill this virus, it's actually producing the virus itself. So that's how it kind of overruns your immune system. This happens slowly. This isn't something that happens like, hey, Monday I get the HIV and Tuesday my immune system's overrun. No, as years go on and my body is continuously making cells to defeat this virus, it's continuously making the virus, right? So that's how this is such a like lucky or smart or whatever you want to terminologize that, if that's a word. However you want to think about this virus, but that's why it's so difficult to stop, is because it's, again, your immune system's making the virus stronger in an attempt to kill it, right? So if that doesn't make sense, hopefully maybe this will here. This next slide, assuming it shows up. All right, so this is a pretty good image here. HIV can only infect human beings, interestingly enough. All right, so HIV attacks your T cells. We just talked about this, and uses them to make a copy of itself, right? So that's what I just talked about. It's just, this is an image that hopefully makes any sense, right? So here's your T cells. Here's the virus. Here's your T cells. Your T cells go to create the virus. So typically speaking, the T cells destroy the virus, right? But instead of destroying the virus, what happens is as the T cell goes in there and replicates, the virus replicates with it, okay? So it uses the T cells to make copies of itself. When the HIV destroys so many of your cells, that's when you have AIDS, all right? So AIDS is the disease, and AIDS just basically means that you no longer have any sort of an immune system. Hopefully this makes sense, right? If you combine the lectures of viruses and your immune system into right now, this should make sense, right? Because your immune system creates T cells, helper T cells to destroy viruses. This virus attaches itself specifically to those cells. So again, as your immune system is creating all of these cells to kill it, it's actually making more of the virus. So you're just never going to kill it, right? So when HIV destroys so many cells, that's when you have AIDS. And basically what AIDS just means is you don't have an immune system, okay? Or your immune system is, you know, you almost don't have an immune system because your body is so busy destroying this virus. All right. So HIV infects T cells. T cells notify the body to produce more T cells. HIV kills and reproduce via helper T cells once the immune system is overridden. You have AIDS. So I just put in words there basically what that image is showing you. Hopefully that makes sense to you. Okay. Again, if it doesn't, feel free, email me. I can, you know, do another slide on this and explain it a little bit more in detail if I need to. Trying to keep it simple, as simple as possible. All right. You know, it's almost as if like we're preparing to go to war. So we're making a bunch of soldiers. All right. But from slowly as we create 100,000 soldiers, you know, at first 100 of them are foreign enemies that have infiltrated our military. Right. So then we make 100,000 more. And now we have 300 spies that have infiltrated our military. I don't know if that makes any sense, but just trying to give you different ways to think about this virus. All right. The more your immune system does to fight it, or the more your immune system, you know, fights any kind of disease, and the more T cells your immune system makes, the more it replicates the HIV virus, and the quicker your immune system becomes overrun. All right. Waiting for slide to transition. There it goes. Opportunistic infections. I know I'm still talking. But again, I'm giving you 2 days, today, tomorrow, to listen to this. And honestly, if you broke it up for 10 minutes today, tomorrow, Friday, Saturday, Sunday, Monday, come on. I'm not asking much here. Opportunistic infections are infections that attack a weakened immune system. So think of opportunistic infections as like, I don't want to say the bully, but it's kind of what they are, right? Like, so, you know, there's a country in Europe called Luxembourg, right? If Luxembourg and the United States went to war, Luxembourg, if you don't know, all right, it's very small. I don't even think they have a military. They're like the size of a city. All right, not a lot of people. The United States and Luxembourg in war, you know, apples to apples really does. Luxembourg doesn't stand much of a chance, I guess is what I'm trying to say. Right. So like for the flu, okay, the flu in your body, most of the time, 99.9% of the time, the flu in your body, not a big deal, right? You might have a couple of symptoms. You might feel bleh for a couple of days, but you're going to be fine. Okay. So what happens is that when your body becomes overrun by the HIV virus, and your body's so busy, your immune system is so busy fighting the HIV virus, it opens the door for other viruses that typically speaking aren't a problem for different reasons to become a really big problem. All right. So, you know, something like the flu is going to, you know, if my immune system is just wrecked, right, because I have been fighting the HIV virus for so long, and that's, you know, that's all my immune system can basically handle at this point. All right. Is it can only handle the HIV virus, right? And now I get another virus or bacterial infection added to that. All right, well, you know, my immune system just simply loses the capacity to fight that other virus, right? So is Luxembourg a problem for the United States? No, it's not. All right, but if the United States is fighting Russia and Canada and Mexico and Austria and Australia and Germany and Poland and, you know, half of Africa, and then Luxembourg comes in, well, that's a problem for the United States. We're just out of resources, right? That's kind of what happens with opportunistic infections to your body, right? One of these things, I mean, tuberculosis can be serious. I don't mean to discount tuberculosis, but it might not be the best example right now, but it's a popular opportunistic infection is what I'm saying. All right. So tuberculosis in the United States, usually not a problem. But when you start talking about a weakened immune system, like all those vaccines that you get when you comes to your immune system, HIV can basically make those vaccines useless. All right. It can just wipe out your immune system completely. All right. So something like tuberculosis can be a problem. All right. You don't need to write that down. Fungal infections. We didn't talk about fungal infections in terms of pathogens, but typically speaking, fungal infections are easily treated or defeated by your immune system, treated with like a cream or something like that. When it comes to, opportunistic infections, it can cause real problems because your body just doesn't have the capacity to fight it off. All right. Again, the basic cold becomes a problem. Cervix cancer is a possibility. Lesions on your skin or your mouth. All right, so that's a fungal infection example. If I have HIV, that can be really nasty. These are kind of like some lesions. Bruises aren't the best word for them, but this is kind of what can happen to your body when it comes to HIV. It's a symptom of lesions that can show up on your skin. All right. And that's what opportunistic infections are. All right. So transmission. Almost done here, folks. Hang tight. Sexual contact of any kind. Okay. Just like any STI, any kind of sexual activity can lead to the transmission of HIV. Okay. No different than gonorrhea or anything else that we've talked about here. Shared needles. So, there has been in the past in different pockets, even recently in our country's history of pop-ups or increases in HIV. Specifically, that's happened in in places in our country where drug use has become more popular, especially intravenous drug use, right? Because Coach Moore has HIV. I use a needle to inject drugs into my veins, into my bloodstream, and then I take that needle, hand it to my friend. They use it, and I just give my friend HIV. So drug use, blood to blood. So it's not just any kind of sexual contact, but also blood to blood contact can be a STI, can cause that. Mother to babies is a possibility. It can happen in pregnancy, it can happen in birth, and it can happen in breastfeeding. There are procedures, C-sections. There are things they can do to really help stop this from happening nowadays, which is kind of amazing. Obviously, moms that are HIV positive might be asked not to breastfeed. You might have a C-section in terms of how the baby is born. And then when you're in pregnancy, there's actually the possibility for certain drugs that can reduce the risk of the mother to baby transmission, which is kind of amazing that they can do that much now. Just to kind of, anyway, we'll move on. We won't say that. Treatment. So this is advancing all the time. This virus has been around now 30 years, and so that there's lots that they could do. I'm actually gonna skip this slide in terms of talking about it, just because I'm not going to test you on it. But basically, the goal of the treatment is to basically keep you as healthy as possible all the time. So it's a very rigorous form of medicine that's being taken, and you're probably taking lots of different types of medicines a lot. And the whole goal is we're trying to keep you as healthy as possible for as long as possible, right? Because if your immune system's not fighting any other viruses, and if it's not fighting off any other pathogens, it's not making T cells. And if I'm not making T cells, if I'm not making T cells, then I'm not causing the virus to spread. So I'm really keeping that viral load of HIV positive cells at a minimal. And so that's kind of the idea of viruses, or excuse me, of the treatment for this specific virus. And there's other things that they can do now that we're just not going to get into. Here's another bell work for you. True or false, HIV eventually becomes AIDS. Completely answer your question. So if you're using this, don't just write true or false. I want you to tell me, if you're saying it's true, HIV eventually becomes AIDS. If that's true, tell me how it becomes AIDS. If it's not true, explain to me why then there is this connection between HIV and AIDS. What is the actual connection? Maybe that's a better way to ask that question. What's the connection between HIV and AIDS? So if that makes more sense to you, if you're answering this bell work, which is a really good unit test question. What is the connection between HIV and AIDS? That's probably the better way to ask this bell work. All right. So if you want to write that down and answer that, that's fine. That's a really good unit question. It's probably going to be a question on your unit test, something along those lines. So just to be prepared for that. Last thing, deep breath. Last thing we're talking about is the stages of HIV. All right. The first is the asymptomatic stage, where basically you either have one or none symptoms. Flu-like symptoms, you can have a flu for a long time that doesn't, seemingly takes a long time to go away. And then you can go years without any sign of this, right? I mean, years without any sign of having HIV. So you could just think, oh, I had the flu for a couple of weeks, a really bad case of the flu for a couple of weeks, a couple of years ago. I'm fine now, right? Nothing to worry about. Because again, all of my symptoms have gone away. Meanwhile, every time you get sick, you're probably getting more sick than you used to. And as the more and more you get sick, and the more and more your T cells are reproducing, they're also making more of the virus. So that virus is slowly spreading in your body, and eventually will cause significant damage. So the first stage is basically you don't have symptoms, or you have one symptom, which is a flu, early on. Okay, and then that'll progress here into the symptomatic stage. All right. Weight loss, a persistent fever, diarrhea, and or fungal infections. And this can take anywhere between 7 to 10 years after the infection actually happens. I mean, just think in terms of like these symptoms, think about having a virus or being sick for an extended period of time, right? Like, I don't know about you, but when I get sick, I don't want to eat much, right? Most people don't have much of an appetite when they're sick. So weight loss happens because you just don't eat anything, right? Persistent fever, because your body's constantly fighting off an infection. That's why you get a fever. A fever is usually a sign that your body is a sign of an infection, but it also is a sign that your body is fighting the infection. If your fever is super high, that means your body is working really, really hard. If your fever starts to come down, that means that your body's having some success fighting this infection. It doesn't need to work as hard anymore. Simplifying things to a certain extent there, but that's why you're going to have a persistent fever, is because your body's always going to be fighting an infection. All right. We've talked about the fungal infections. Okay. And this can happen anywhere between 7 to 10 years after you've had the infection when it comes to the HIV virus. And then the last step is actually AIDS. Okay. Again, this is simply marked by when they draw your blood, what does your T cell count look like, right? If your T cell count, meaning the amount of T cells that you have, if your T cell count is overrun by T cells that have the virus, 97% of the T cells that you've created now have a virus attached to them. At that point, you basically no longer have an immune system. And so at that point, you have AIDS. You can be diagnosed with AIDS, which basically means that your immune system has been wiped out. So severe symptoms of a healthy person's immune system. Again, we talked about this. So severe symptoms a healthy person's immune system could easily fight off. Your immune system's not fighting those off, right? The basic cold, you're going to get the worst of the basic cold. You're going to get the worst of the flu. You're going to get the worst of whatever virus enters your body. You're going to get all of the symptoms because your immune system is just, you basically don't have one. Okay. I am simplifying things, but I think hopefully if you're paying attention, this gives you a pretty good understanding of how the virus progresses when you're specifically talking about AIDS. All right. All right. Last thing here, and I'm crying because this is the last slide of the year. It's been, a different year to say the most. Hopefully this class has been some sort of a relief or distraction. Not so much a burden for you guys. Your exit pass completely explain the progression of HIV. In other words, how does it attack a person's body? So this is similar to the last Bellwork question, if we're being honest. But you don't have an option. You have to answer this question, right? So, this is going to take a couple of sentences, 4 or 5 sentences for you to answer, right? So explain the progression of HIV. In other words, how does it attack a person's body? I get HIV. I end up with AIDS. What happens in the middle here? Okay, what is actually going on? I want you to put it in your words so that I know that you understand what I'm talking about. This question, or a question very similar to it, is going to be on your Unit exam for sure. All right. Next week again is that unit exam. So the only thing I'm going to ask of you next week, Tuesday, on chapter is to take your chapter 22 test. Shouldn't take long. Basically, the reason I'm doing that is for easy points at the end of the semester here. So do that, get it done, do well on it. Any work that you haven't done, get it to me. I've been very flexible with this. I'll continue to be flexible here for the last week. If you don't have something turned in and you turn it into me, I will. I'm not gonna. I don't know that I'm gonna give you all credit for it, but I might give you some points for it, and some's always better than none. So if you don't have work turned in, get it to me. Email it to me, and let's have a conversation about that. Or let's have a conversation about why your grade isn't where you need it to be and how we can get it to where it needs to be. All right. Have a good summer. I think everyone is going to have high hopes for the summer. Continue to have hope. Having hope is a good thing. I hope it's a great summer. I hope you all stay healthy. I hope your family stay healthy. And I hope that in the fall we can see each other in normal, quote unquote, normal circumstances. Hopefully we all don't have to be dressed like Bane from Batman when that happens. But one way or another, I think we'll take it at that point. So I've missed teaching you guys. I've missed being at school, seeing you face to face, being in person. So I can't wait till that becomes a thing again. But again, have a good summer. Again, next week, your unit test, I'm giving you Wednesday, Thursday, and Friday to do it. Please do it one of those 3 days. It'll be posted probably Wednesday morning. But that's it. That's it for Coach Moore. I'm out. Deuces. Enjoy your summer. Make sure you get your stuff in. Feel free to email me. Just email me because, hey, man, Coach Moore, awesome lecture. Any reason you want to email me, email me. All right. God bless you all. Be safe. Be healthy. And I will see you in a couple months. Have a good summer, guys.